everyone. Welcome to this masterclass, which has been scheduled for part 1 students, and it is just before the exam. So we are going to go through 45 questions in a row, and we will practice these questions from the recalls. So most of these questions are from 2023. So it's a good practice because we all know that this is the very important question bank. So it is only what students remember or only the things which come up in front. Okay. So let's start with this session. We are going to do 45 questions today. So here is one of the most favorite topics of RCOG, rectus sheath. Rectus sheath is formed by which of the following? External oblique and rectus abdominis aponeurosis, internal oblique and rectus abdominis aponeurosis, rectus abdominis and pyramidalis aponeurosis, aponeurosis of internal and external oblique, and aponeurosis of transversus and external and internal oblique.
E.
So very good. E is the correct answer. So that is all the three aponeurosis will form the rectus sheath. Now this is the question which came in the last 2023, but there are other questions associated with. One of the most important and favorite question is in the lower part. In the lower part where we give the incision of cesarean section, which layer forms the posterior sheath?
Transverse speech.
Which layer forms the posterior sheath of posterior layer of the rectus sheath when we give at a place where we give incision for cesarean section? That is Phalansteal or John Call.
Fascia transverse.
So basically there is no rectus sheath because sheath is not there. No posterior layer of rectus sheath is there. It is just the fascia which is there, right? Aponeurosis is not there, right? So posterior sheath is absent in that place. It is only the anterior layer is there, and all the three come anteriorly and form the anterior layer of rectus sheath. And posterior sheath is absent. Posterior layer of sheath is absent in that place. Clear?
Yes.
Fine. Any confusion? Okay.
No, ma'am.
Sorry, this is not here. So looking at the diagram of fetal skull below, what is represented by the part labeled? So here it is.
Parietal bone.
Okay. Yes, so we have this labeled as a parietal bone, and it is a very, very important diagram of fetal skull which comes in exams. Right, so let's just take it. This is parietal bone. We have to know all the other structures as well. So, what is this central suture?
Sagittal.
Sagittal suture. And what is this one? The one behind?
Lambda suture.
Lambdoid.
This is the lambdoid suture. And what is this here?
Coronal.
Anterior
Frontal.
fontanelle.
This is the anterior fontanelle. And when does anterior fontanelle closes?
18 months.
18 months.
18 months, right. And what about the posterior fontanelle when it closes?
3 months.
3 months.
3 months. So there are multiple questions, multiple important questions from this particular diagram. Uterine vein drains where?
Internally like.
So always remember, if you are a bit confused, like you thought for a moment or so, always remember the artery from where it was coming. Okay, so uterine artery, it will go to uterine artery arises from anterior division of internal iliac artery. So this will go with the internal iliac vein. So anterior iliac vein is the correct answer. So the next thing is, next question is, what about the left ovarian vein? Where does it drain?
Renal vein.
Left renal vein.
Left renal.
Yes, correct. So
Left
that
renal
is a different, slightly different question. So it is very important for the exam. What is the relation of superior vena cava and the pulmonary trunk?
Medial to pulmonary trunk.
SVC is medial to pulmonary trunk.
Okay. So here we look at this diagram. So here it is. So if you see, this is SVC, in between is the aorta, and here is the pulmonary trunk. So SVC is slightly lateral. In this, it is shown in a bigger way. So you can see so much distance in between it. But SVC is lateral to the pulmonary trunk, slightly lateral. Partly they overlap even. So it is slightly lateral to the pulmonary trunk. Yes, there is a C answer in the chat box. Correct. Dorsal nerve of clitoris is a branch of internal pudendal. Oh, sorry. Answer is already written. So dorsal nerve of clitoris is a branch of
Internal.
internal pudendal. There is now nothing internal pudendal. It's wrong written and everybody is also speaking. What is the correct answer?
Pudendal.
Pudendal nerve.
Pudendal nerve. There is no nerve known as internal pudendal nerve, right? So it is pudendal nerve. So dorsal nerve of clitoris is one of the 3 terminal branches of pudendal nerve, and it is basically the sensory supply to clitoris. Caput medusae is formed by
Umbilical veins.
Paraumbilical veins.
para-umbilical veins. It is one of the site of
Portocaval
portocaval anastomosis. Correct. Root value of obturator nerve is
S2 to S, L2 to L4.
is it para-umbilical or umbilical veins? It is umbilical veins, but there is a axis there. So sometimes the word is also used as para-umbilicus because you see the all those dilated vessels around the umbilicus in a way. So it is sometimes the word used as para-umbilical, but yes, umbilical veins is the correct answer. Both the words you can get in the literature. Okay, so the root value of obturator nerve is L2 to L4. That is correct answer. So you should know all the nerves of the lumbar plexus very nicely. What are the segments? So L2 to L4. And you can also have a diagram like this in your exam with a pointer, and you need to identify. So here is the obturator nerve in this, okay, the medial most. Now this is the psoas muscle and this is one nerve on it. Can you tell me what nerve is this? Genitofemoral. Yes, this is genitofemoral nerve. So very, very important. These all nerves inside, on anterior to psoas, lateral to psoas, medial to psoas, they are a very important question from exam point of view. So you need to, you should be able to actually, if they give a diagram with a pointer, you should be able to identify it. Diagonal conjugate is measured from
sacral promoted lower border of the symphysis.
yes. So
Sacral border to lower border of symphysis.
Pubic symphysis. Which nerve is lateral to psoas? Anybody?
Femoral nerve.
Femoral.
Femoral nerve is lateral to psoas. And which nerve is medial to psoas?
Obturator.
Obturator nerve. That is medial to psoas. Anterior to psoas is
Genitofemoral branch.
So here it is diagonal conjugate is sacral promontory to lower border of symphysis. Now what is the distance?
12.5.
12 centimeter, 12.5 centimeter.
12.
Yes,
12 centimeters.
12.5 centimeter. What is obstetric conjugate?
10 centimeter. It's the upper border.
Upper border of
Pelvic
promontory to
symphysis.
symphysis pubis.
Yes, that is the upper border of the symphysis pubis and it is 10 centimeter. Correct. So we learned this is diagonal conjugate, there is obstetric conjugate. Diagonal is from sacral promontory to lower border, while obstetric is to the upper border. And the diagonal is 12.5 centimeter, while the obstetric is 10 centimeters.
10 centimeter.
Correct? Fine. So here's the diagram. You can see here obstetric and the diagonal. Inferior rectal is branch of
Internal pudendal artery.
Internal pudendal artery.
it is a branch of internal pudendal artery. So this complete tree, that is right common iliac, then your internal iliac, external iliac, particularly the internal iliac, the divisions, anterior division and the posterior division, and its branches. They are very important. And here you see this is the internal pudendal and this is the inferior rectal here. So important to remember this complete arterial tree for the exams. Multiparous women presents with uterine descent. Which ligament is likely to be responsible?
Cardinal ligament.
Cardinal ligament.
Yes, correct. It is cardinal ligament. Cardinal ligament is most important and that is responsible for the injury in the cardinal ligament is responsible for the prolapse. 28-year-old woman presents to the gynecology clinic with a history of dysmenorrhea, dyspareunia, and menorrhagia. Vaginal examination reveals a thickened nodule in posterior fornix. Which anatomical structure is most likely to be affected?
Uterosacral
Ligaments.
Yes, so you are feeling basically the thickened uterosacral ligaments. And what is the diagnosis? What is the scenario here? Which
Endometriosis.
Yes. So this is a scenario of endometriosis which has affected the uterosacral ligaments. Good. Pudendal nerve supplies to all of the following except
External anal sphincter.
internal
Anal sphincter.
clitoris, sphincter urethra, and labia majora. So yes, internal
anal sphincter.
Yes, that's a correct answer. What is the supply of internal anal sphincter?
Pelvic flanking nerves.
Yes, it is basically the involuntary. So this is flanking nerves. So here is this pudendal nerve, the pathway. It arises from S2 to S4. So here it goes and it then hinges around the ischial spine, goes out through the greater sciatic, hinges around the ischial spines and enters back into the perineum through the lesser sciatic foramen. And then it gives its three main branches. One is inferior rectal nerve. Then this is the perineal nerve, which supplies all the muscles of superficial and deep perineal pouch and gives branches to scrotum and the urethra or the majora and the minora. And this is the dorsal nerve to penis or the clitoris. So three main branches are there. Very, very important nerve for the exam. Lateral boundary of ischiorectal fossa is formed by
Obturator
Internus.
Yes, correct. It is obturator internus. You can have obturator fascia in exam 2, obturator membrane. So these are all correct answers. So their borders are superficially there is skin, anteriorly the anterior perineum is there, posteriorly the sacrotuberous ligament and gluteus maximus. Medially you have a levator ani and the external anal sphincter. And then laterally, there is the ischial tuberosity with the obturator internus and its fascia. And this is the Alcock's canal. That is pudendal canal of Alcock's with pudendal vessels and the nerve. What are the contents is also important. So ischiorectal pad of fat, pudendal canal is in the lateral wall and transversely. From here, the inferior rectal vessel arises and it goes transversely across it. Clear till now? Any questions? Fine. Shall we continue?
Yes.
Yes.
All of the following are symptoms of retroverted uterus except rectal pressure during intercourse,
UTI.
UTI, urinary incontinence, or prolapse.
Prolapse.
Urinary
incontinence.
Okay. So I have two answers: urinary incontinence and prolapse. Right? Anything else?
UTI.
Okay. UTI is the third answer. Okay, now let's look at it. What is happening? The uterus is going back, right? So angle is disturbed. So rectal pressure is going to be there, right? Everybody agrees?
Yes.
Pain during intercourse,
Yes.
right? Now what is recurrent UTI and urinary incontinence? The angle is disturbed, right? So if the urine is being retained, that will lead to recurrent UTI, and the urinary angle being disturbed can lead to urinary incontinence. But prolapse has nothing to do with the retroverted uterus. So prolapse is the correct answer, right?
Okay, ma'am.
Urinary problems can be there because see, there is the alignment is disturbed now. Normally the bladder in front, vagina and angle of vagina, that all is disturbed. So as it is disturbed, the urethral angle is also disturbed. So that can lead to recurrent UTI and urinary incontinence. And posteriorly, the rectal pressure is already there, pain is already there, but prolapse has nothing to do with that.
Okay.
Yeah.
Okay.
So prolapse is the correct answer. Most common route of spread of choriocarcinoma is
Hematogenous.
hematogenous. This is a very, very important question, and I think in majority of papers you will find this question. Very, very important. Now, the layers which sperm penetrates as it goes inside the egg. So from outside to inside. From outside,
Corona radiata.
Zona pellucida, perivitaline space,
Perivitaline space and
and then perivitaline space.
so the outermost is the corona radiata, followed by, you can see here,
Zona pellucida,
the corona radiata, then there is zona pellucida, followed by
perivitaline space,
space and
plasma membrane.
plasma membrane. So from outside to inside, the layers through which the sperm passes are corona radiata, zona pellucida, vitelline space, and
plasma membrane.
yes, this is very important question. Many times it comes in exam. Now, muscles not inserted in perineal body. Not inserted. Ischio-cavernous, bulbous spongiosus, superficial perineal muscle, external aspirator, and none of the above. Yes. Everybody agrees with ischio?
Yes.
So ischio-cavernous is a correct answer, because if you see this diagram, this is an important diagram. You can have any pointers at any particular place in this too. So here, this is the perineal body. This is the bulbocavernous, which is coming here. This is the transverse perineal, which is coming here. And of course, the anal sphincter, that is also coming here. But the ischio-cavernous, they are here, laterally. So they do not come to the perineal body. So this is the correct answer. And this diagram and these recognition of these muscles, this is important for exam point of view. Gastrulation is process of
Development of three germ layers.
Development of three germ layers.
yes, correct. So that is development of three germ layers. Maternal blood is filtered by
Glomerulus.
glomerulus. Correct. This was slightly new question in this exam, but then it's an easy question. I think that is a simple biology. Which of the following laboratory techniques is used for RNA synthesis?
Not a lot.
Not.
Northern blotting. That is the correct answer. Okay. Now identify the structure marked with black bar. So here it is. This one. What is this?
Ligamentum flavor.
Epidural space.
Epidural space.
Okay. So everybody agrees with epidural? Or any other answers? Epidural space is the correct answer. So basically, this outside this dura and the spinal cord, the space between the two, this is the epidural space. Outside the dura, this is epidural space. Okay. So this is a very, very important space and very, very important diagram. You should be able to recognize this space either is in this horizontal cut section or maybe they give you in a vertical cut section as well. So you should be very much able to appreciate that. So epidural space, there were two questions in the same paper, right? So two questions about the epidural space, one in the diagrammatic way and one in a theoretical way. So epidural space is between
Dura and
Vertebral canal.
yes, correct. 24 years old female presents with pain, lower abdomen, vaginal discharge and itching. Gram stain shows gram negative cocci. What is the likely organism?
Neisseria gonorrhea.
Yes, when we talk about the cocci, gram negative, it is Neisseria gonorrhea, and you can see a young female, less than 25 years, pain, lower abdominal, discharge, itching. So everything in favor of 16-year-old has recently become sexually active. She complains of intensely irritating greenish frothy vaginal discharge. The organism is seen under microscope with perinuclear halo. What is the most likely causative organism?
Trichomonas vaginalis.
Vaginalis.
So green frothy vaginal discharge is characteristic of Trichomonas vaginalis. So that is the correct answer here. And what is the finding in the cervix? The characteristic finding we see in Trichomonas?
Strawberry cervix.
Strawberry cervix. And it is present in how many percent of cases?
2%.
Only 2% of patients have strawberry cervix. But that is a characteristic of trichomonas. So all these are important points from which questions are asked about trichomonas.
And ma'am, metronidazole is drug of choice?
Yes, metronidazole is drug of choice. Correct. A patient presents to clinic with a maculopapular rash to the hands and soles of feet. Examination also reveals somewhat like lesions to the vagina. You diagnose condyloma latum. What stage of syphilis infection is this? Primary,
Secondary.
latent or late latent? Yes, this is secondary. So these are maculopapular rashes. They are characteristic of secondary syphilis. What is the characteristic feature of primary syphilis?
Chancre.
Yes. So how do you explain chancre? What keywords you will get in exam?
Painless.
Yes, largely painless solitary ulcer. So that is the syphilitic ulcer. Dome-shaped, pearly, white, centrally umbilicated lesions are characteristic of
MCV pox virus.
Molluscum contagious. Pox virus.
So, yes, here they did not give the molluscum contagious directly, but the term used in exam was MCV pox virus.
MCV pox.
So, MCV is molluscum contagious virus. So, that is same. But just to confuse you, like directly didn't try molluscum contagious and gave this term. So, but this is the correct answer. Yes, MCV is the correct answer. Which of the following drugs is a dry hydrofolate reductase inhibitor?
Methotrexate.
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 Yes. Methotrexate is a dry hydrofolate reductase inhibitor. Sometimes they also give you irreversible or reversible term too. So what to choose?
Reversible. Reversible.
Irreversible, right? A and B, nitrofurantoin. But usually in exam, you will have either this question for the trimethoprim or methotrexate. Yes. So yes, it is irreversible, correct. So basically, yes. Oh, yes, correct. You are correct. But it usually the question which is asked in exams is the irreversible dihydrofolate reductase inhibitors. And there the answers are either trimethoprim or methotrexate. They are the two most commonly asked drugs in it. Correct. Which of the following antifungals mechanism of action involves binding to fungal cell membrane phospholipids and subsequent inhibition of ergosterol biosynthesis?
Terbinafine.
D. Clotrimazole.
Clotrimazole.
Yes. Binding
Clotrimazole.
fungal cell membrane phospholipids and subsequent inhibition of ergosterol biosynthesis. So the correct answer is, of course, clotrimazole or fluconazole. These all group of drugs. Clotrimazole, ketoconazole, meconazole, and fluconazole. The imidazole group of antifungals work by binding to phospholipids in the fungal cell wall and inhibit the biosynthesis of ergosterol and other steroids. The change in cell permeability leads to cell death. Right? So this is your imidazole group of antifungals, which is the answer. Mechanism of action of antifungals, antibiotics, antivirals, all is very, very important for exam point of view. Which antiviral inhibits the activity of HIV-1 reverse transcriptase via DNA chain termination after incorporation of nucleotide analog?
Zidovudine.
Yes, zidovudine is the HIV-1 reverse transcriptase. So it is correct answer. Tamoxifen is associated with increased risk of which of the following?
Endometrial cancer.
Endometrial
Cancer. Yes, gynecomastia, ovarian cancer, and induced lactation. So endometrial hyperplasia leading to endometrial cancer. So that is the correct answer. To which category tamoxifen belongs?
Selective estrogen receptor.
Selective estrogen receptor modulators. So SERM is correct answer. Yellow staining of teeth in babies is caused by the mother taking which of the following during pregnancy?
Cycling.
Yes, so drug from tetracycline group basically. So it is cycline here. So yellow tooth staining is a side effect of tetracyclines used during pregnancy. What is the maximum dose of lidocaine that should be used on a 70 kg woman who is 12 weeks pregnant?
21 ml 1% lidocaine.
21 ml 1% lidocaine. How do we calculate?
3 ml per
7. 3 into
dose
7.
per kg. 3 ml per kg.
Yes, so 3 ml per kg. So here it is 70. So 21 ml 1% lidocaine is correct answer. Now, just let me know when we use lidocaine with adrenaline, then what is it?
7 milligrams.
7 is the correct answer, right? So 7 is the correct answer. Here is your calculation. So 210 milligrams is there when you calculate for 70 kg, and this is 21 ml because it is 1% solution. So it is 1% plain lidocaine. Rh negative
Can
population
you
of,
repeat the use of lidocaine with adrenaline?
okay, so that is 7 milligrams per kg. Like we have calculated here with 3 milligrams per kg. In that case, we will calculate it by the 7 milligrams per kg. Okay.
Okay, ma'am. Thank you.
Rh negative population of UK, how much percent?
15%.
15%. Okay. Anybody else? Any other number from anyone? 15% is a correct answer. Very good. 15% is a correct answer, and it is also a repeated questions in recalls. So Rh negative population in UK is 15%. A figure to be remembered for exam. Vasopressin is synthesized by
Paraventricular and supraoptic nucleus of hypothalamus.
paraventricular and supraoptic nucleus of hypothalamus. So that is the correct answer. So A is the correct answers. This is hypothalamus here. Posterior pituitary, anterior pituitary, these are all wrong. Correct. 60 years post-menopausal old woman with 4 into 6 centimeter multinuclear cyst with solid septa and ascites. CA125 is 100. Calculate the RMI score.
900.
900.
900.
So how to calculate?
3
for postmenopausal, 3 for
She's
positive findings
postmenopausal, so 3
USG.
and then
3
100
1
and
USG findings,
the
so it is 3.
features.
Yes. So basically we follow the RMI1 scoring, and here it is ultrasound features, multilocular cyst, solid areas and ascites. 3 are positive. So 3 is a 2 or more abnormalities, the score is 3. For postmenopausal, the score is 3. So 3 into 3, 9, and CA125 is 100. So our answer is 100. Okay?
900.
900. That's a correct. Now, one important thing to remember is sometimes they do not give you any of these features. Okay? They do not give you any of these features, then don't mark it 1. No abnormality is 0. So in that case, your RMI score will be 0. Whatever CA125 will, it will be 0. So remember this very important thing. Okay? If they do not give any of these 5 features, then it is 0 and your RMI score will be 0. Don't mark it 1. Okay, and if there is 1 feature, then it is 1 score. But if it is 2 features, then also the score is 3. Right? There is no 2 score here. So 0 for no abnormality, 1 for 1 abnormality, and 3 for 2 or more abnormalities. Right? One question is definitely going to come about RMI, and 0 also many times comes in exam. So please take care. At that time, you will become confused between 0 and 1. So just remember this point there. Which of the following drugs is a strong inducer of cytochrome P450?
Phenytoin.
Yes, phenytoin is the correct answer. Urea cycle occurs in which organ? Very favorite
Liver.
question.
Liver.
Liver. It occurs in liver. Very, very favorite question, and it is repeated many times in exam. So it's a liver. In which part of cell does glycolysis take place?
Cytosol.
Yes, very good. It is cytosol. And if your question is where does Krebs cycle takes place?
Mitochondria.
So there are 2 options.
Mitochondrial crystal.
Christie. Christie. It is Christie. Correct. Prostaglandins are inactivated in liver,
Lung.
kidney,
Lung.
intestine, lung, and brain. So correct answer is lung.
Lung.
Correct. So this is also very important question, many times repeated. Which of the following is commonly used to determine hormone receptor expression, receptor status of the breast cancer?
Hybridization.
Immunohistochemical staining. That is the correct answer. You have various markers, like there are tumor markers which are used for the immunohistochemical staining. So that is the correct answer. Sometimes they do not give this receptor status, rather they give you that you want to look at the estrogen positive receptors or progesterone positive receptors. So they give you something like that. And then again, the answer is immunohistochemical staining. Very important and repeatedly asked in exams. HPV vaccine Gardasil is what type of vaccine? Live
Natural
Recombinant vaccine of
Virus-like
virus-like
particles.
Yes.
Virus-like particles.
Virus-like particles.
Recombinant vaccine of virus-like particles. This is correct. And what are the strains in the Gardasil?
4 strain.
6, 11, 16,
11,
18.
16, 18.
6,
6
11,
and 11, 16 and 18.
16, 18.
16 and 18. Very good, correct. So that's a correct answer. Is this time there were at least 3 questions from HPV were there in exam. So HPV genotypes 6 and 11 are associated with which of the following? High-grade squamous intraepithelial lesions, low-grade squamous
Low grade.
lesions, CIN3, squamous cell carcinoma, or CIN2. Yes, low-grade squamous intraepithelial lesions of the cervix is correct because 6 and 11 are benign. So these are basically low risk and commonly associated with the genital warts and low-grade intraepithelial lesions. Correct. Very favorite chart. So you have to see what is here. This is the androgen synthesis pathway, and they can put up a bar anywhere. So what is here?
DHTR.
DHT is here.
Epiandrosterone.
This is also androstenedione. Just before the testosterone, it is androstenedione. So this pathway is very important. Please remember it by heart. Multiple times it is asked. 31-year-old patient undergoes an elective C-section delivery. You estimate blood loss has reached 1000 ml and you suspect uterine atony is the likely cause. Following bimanual uterine compression, what pharmacological intervention is advised?
Centosinone 5 minutes by slow IV injection.
Slow IV injections.
But that is, here they didn't give you the option for that. Although I agree the correct answer is you have to give infusion now. So what is here? Here they have given centosinone 5 units by slow intravenous injection because 1 bolus dose is allowed. So ideally the answer should be centosinone 40 international units. That is the correct answer here. But that is not an option and these are single best answers. So sometimes it happens. You don't have a perfect option, but then you have to choose the closest one, which is the best among others. So direct, the centosinone 5 units by slow intravenous injection is correct here. Usually this centosinone in dosages of 5 units intravenous is used for the active management in cesarean section. In vaginal delivery, the prophylactic dose is 10 international IM. Correct? So that's it. Okay. Now the first, if they ask like the patient has PPH, what is the first step or what is the initial step to in the management of PPH?
Call for help.
Help for
Call for help. That is the answer. And you will, majority of the times you will have this question only, where the answer will be call for help. So don't forget and don't forget that option and jump immediately onto the pharmacological options, right? Read your question very carefully. They usually ask about the first step, and that is call for, right?
But ma'am, what would be the next pharmacological action? Whether it will be ergometrin or carboprost?
Carboprost. Carboprost.
So, ma'am, what's the answer for this question?
This question's interested on 5 units by slow intravenous injection.
Ma'am, carboprost IM or intramyometrial injection?
IM injection. Intramyometrial is not evidence-based.
Thank you, ma'am.
Yeah, so it is IM.
Okay, ma'am.
After first bimanual compression, then you give syntocinon infusion. That should be the perfect answer. Or 1 dose of bolus can be repeated for syntocinon. After that, it is carboprost and then it is misoprostol. Syntometrin is an answer where you give synto plus ergometrin combination. You will read that in part 2. This is not an answer usually for your part 1 exam, but where the multiple risk factors are there and you want to give something for prophylaxis, then you use the syntometrin.
Ma'am,
Right?
meso is 800 or 1000 the dose?
800. This is not
Okay.
correct. Yes.
Okay, ma'am.
So that's it. So these are the sequence of the pharmacological measures. But trust me, most of the times you will be asked only till the call for help or the active management of 3rd stage of labor. So if you are choosing something above that, just think twice about it, whether question is really asking about something higher to that, right?
Yes, ma'am.
Delta cells of pancreas secrete.
Somatostatin.
Somatostatin.
Correct. So that is again a very, very commonly asked and important question, right? So I think of whatever questions we have done today, you will certainly get around 10-15 questions from these in the exam. And probably you will there remember my voice. Okay. So we finished our 45 questions for today's master class. Now, if you have any queries, you want to ask anything about the exam, you are very much welcome to do that.
Ma'am, one doubt, ma'am.
Yeah.
In active management of 3rd stage labor, is it delayed cord clamping or early cord clamping, ma'am?
Delayed cord.
Delayed cord clamping.
Okay, ma'am. Thank you, ma'am.
Ma'am, can I ask from doubt, ma'am?
Yeah.
Ma'am, during exam, we'll be given this pen and to do our calculations in statistics. We'll be given a pen and pencil from there, or we'll have to
Yes, pencil and paper.
pencil and paper will be given from there. Okay,
Yeah,
okay.
for a work, yes.
Ma'am, location of Krebs cycle, if mitochondria and mitochondrial matrix is given, so we'll go for matrix.
No, the electron transport system is in the Christie. So electron transport chain will be in the Christie. For Krebs cycle, they usually give only mitochondria because both of them are there, like Christie and the matrix. It is both are there. So usually you have only mitochondria. When they give you Christie and matrix, that is usually for the electron transport chain because electron transport chain is particularly in the Christie.
Okay, ma'am.
Ma'am, can you explain differences between translation and transcription?
Okay. So I think anybody from your side would like to answer this, transcription and translation?
RNA is transcription, and mRNA to protein is translation.
So
mRNA.
yes, DNA to mRNA, that is transcription, and from mRNA to the protein, that is translation.
Okay. And reverse transcription?
Anybody?
It's RNA to DNA.
RNA to DNA.
Yes, RNA to DNA.
Okay. Thank you, ma'am.
Yeah. So you are very well prepared. Really good to see. And be ready for your exam. And then we'll see you again in the part 2 preparations.
Thank
So
you so
your
much, ma'am.
positive action combined with positive thinking results in success. So stay positive and do think positive and success will be yours. Right?
Thank you,
I
ma'am.
hope you liked this session and it was beneficial for you. Right?
Thank you.
Thank you.
Thank you.
Thank
Thank
you
you
so
so
much.
much for joining today. Thank you. Good night. Good
Thank you,
night.
ma'am. Good.
Thank you.
Good night.